Hi, Facebook. It's Wednesday. It is Wednesday today, right? Usually I'm here on Thursdays, but hi, welcome on a Wednesday. Thank you all for adjusting your schedule today. And I hope you're having a good day. I'm Sarah Heiner, and I'm thrilled for you to join me. And just a reminder, we're going to talk shortly. I just teased in the little chat box, if any of you are losing your hair, developing acne when you thought you were done with that 20 years ago, whether you're having a rash or weird hives or whatever it is, our skin is very reactive to stress. So we're going to talk today about the stress in the world and how we are processing that in our bodies, and it's literally oozing out our skin. So we're going to learn what you can do, what's going on, and how you can stop it, and love what you're seeing in the mirror a little bit more again. Let me remind you of all sorts of things going on. We've got a whole growing library of these Facebook Live videos that are in the Facebook video section here, Bottom Line's page. If you don't want that, or you want to come back later on and it's a little confusing to go through Facebook, you can come to our YouTube channel, Bottom Line Inc. on the YouTube channel. Again, we've got this lovely, long, growing list of them. Refer them to your friends. Tell your friends to subscribe because we have a whole bunch of stuff to help people get healthier. A couple videos I want to point out, one video in particular I want to point out that's in there. As the COVID cases are spiking, there is a lot that you can do to protect yourself. Doctors aren't talking about it, but there are things you can be doing to build your own defenses and reduce your risk of getting sick. And if you do get sick, to get it severely or to even die of it. So for you and for your family, there's we're going to put the link into the chat here on Facebook, but it's about natural COVID self-defense. So look for that video, click on that link, share that, and follow the advice, please. Very safe, very important. We also have a download, immune boosters that your doctor, again, is not telling you. Nothing against doctors, and Dr. Truong, who's going to be on in a minute, is an amazing doctor, but doctors focus on one aspect of life often and one aspect of treatment, and there's a whole other end of things that we can all be doing to help ourselves. So there are a lot of immune boosters. We have this free download. We've been promoting it for months. If you haven't gotten it, download it now, totally free, no agenda, no advertising. I just really, honest to God, can't stand seeing the numbers and can't stand having us all suffering, frustrated, and locked in. So download that and share that too. Share it away. Tell your friends to go download it, or download it and share it with your friends. I really don't care. I care that you read it and that you follow the advice. Next week, we're on Wednesday again next week at 4 o'clock. Dr. Jacob Teitelbaum is going to be here. We're going to have a great conversation with him. He is a phenomenal doctor. As you know, he's in a lot of these videos, including this one about the natural treatments and protection and self-defense for COVID. We're going to talk to him about his life philosophy and how he's come to where he is in balancing becoming, he was a medical doctor and a holistic practitioner, how he's married those and how he's done that in his life. So it's going to be a unique conversation, one like I haven't done those before. So we'll see what that is. I'm just trying to give you a little bit of mixing up the types of things we talk about here, all lessons, all things that you can then apply to your own life and trying to inspire you. Don't forget, as always, if you have questions for Dr. Truong, if you're having skin issues, then you can pop them into the chat box and someone will pass them along to me, and we will try to get all those answered if we can. If we do not get to all of them in the course of the conversation, I'll see if she'll pretty please be able to answer my emails and we'll get an answer for you. So with that, let me bring on Dr. Allison Truong from Cedars-Sinai Cedars-Sinai Hospital in Los Angeles. So Allison is a board certified dermatologist at Cedars-Sinai. She is a National Psoriasis Foundation Mentor Program. She's won the award for the National Psoriasis Foundation Mentor Program. That's a mouthful. And she's also received the annual Dermatology Innovation Forum nomination. So welcome, Allison. Thank you so much for being here.
Thank you for having me.
All right, high level, let's just talk about the skin. You know, many people know that skin is your largest organ, but not necessarily what that means and how that connects to the rest of the body. So overall, real briefly, could you just give us a little like skin 101 of why it connects? I kind of have coined this phrase in my mind of that your skin, you talk about your eyes as the window to your soul. And to me, like your skin is the billboard of your health, right? That somehow everything just telegraphs through your skin. So let's lay the groundwork because we're going to talk about stress and how it's affecting skin, but let's just real briefly, like where's the skin and the connection to your body function and why it all comes out there?
Absolutely. Thanks for having me today. So I think that the skin and stress connection is still in its infancy in terms of what we know about the research behind it. We know that stress it begins actually in the brain. So we have a organ called the hypothalamus that stimulates the pituitary, which is another part of the organs in the brain, and that all stimulates a process that releases cortisol, which we all know is the stress hormone, right? But that's not the only thing that gets released. There's a lot of other things that gets released. But cortisol is the main stress hormone. And after cortisol is released, it can stimulate different parts of the rest of our body, which we call the sympathetic system. And you may experience this, for example, like I say, back in the day when we're evolutionarily running away from like lions or something dangerous, we get an influx of adrenaline, right? We're running fast. We have epinephrine, we have noradrenaline, etc. And that allows us to run really fast and to be, in a safe environment. But it's meant to be for a short amount of time, right? But in the world that we live in, unfortunately, with COVID and everything that people are going through, a lot of people are experiencing significant stress for a really long time. And to the point where you may not even notice that you're stressed anymore. You're just like, I've dealt with it and I've, been able to control it. But your skin is feeling it. Your skin has receptors that accept these stress hormones and stress neuropeptides. And you may notice it like, I'm more itchy than I ever was, but I've had eczema my whole life. And so there's proteins that are released in the skin that is actually inflammatory in the setting of stress. So these stress peptides that actually begin in the brain, all the stimulate cells all the way down to the level of the skin and the nerves in the skin, and they respond by making more inflammatory cytokines, more itch proteins, et cetera, et cetera. And it's all connected. There's a lot more that needs to be learned. I think we are working on the research behind that. But to put it simply, I think that's kind of what's going on.
Right. And we're going to talk later on about managing stress. Like, we'll talk about some of the things that you've been experiencing in your practice, what your patients are experiencing. We'll talk a little about, what you can do to treat them, but we're going to come back to managing the stress as kind of an underlay of all of it, right? The underlying support.
Absolutely.
So when this stress is happening, there are a lot of skin issues that they say already that are connected to stress. Hives, I used to have hive problems that I would break out in hives. Rashes or other dermatitis or eczema or psoriasis. One of those are very stress related. So is there anything else in the body, like in the digestive tract or in the, like, or is it like the cortisol, the stress attaches it, but are there other things going on in the body as well so that it percolates out through the skin? We've got environments that make the skin vulnerable to, like especially vulnerable. Like it's at bay until your stress goes up and then it kicks it, kind of kicks it into hyperdrive.
Yeah, I mean, I think we sometimes do it to ourselves, to be honest. And I don't know if I'm answering your question specifically, but when you are stressed, you relieve it in certain ways. For example, we have like nervous habits of like scratching your skin, etc.
Mhm.
Um, and as you itch, you scratch and you itch and you scratch, and then we go into this cycle of the itch scratch cycle. We sometimes
Right.
call it.
As I itch, right.
Yeah, exactly. And then, or, just like a nervous tick here or
Right.
there. But then it creates little cracks in your skin. It makes cuts in your skin. And then you create problems for yourself because now you're introducing bacteria in the skin, viruses in the skin. We'll talk about some of these later, but like, for example, herpes or cold sores, like sometimes it's aggravated around the lips by stress because it's already laying dormant in there, but your immune system is being a little bit like lowered by the fact that your body is so stressed.
Right.
And so these things contribute to making all skin disease worse in the setting of stress.
So all of it can, it's like you held it at bay until you got stressed, and now it said, aha,
Exactly.
there's a chink in that armor. I'm coming out.
I'm alive. Yeah.
Right. And
It's
people will frequently get cold sores when their immune system is down or they're stressed.
absolutely,
Right.
whether it's mental, psychological, or physical stress, for sure.
Right.
Because, like, you can imagine people go snowboarding or skiing, and then they're out in the sun, and the sun can damage your skin, causing little cracks in your lips, and so the physical stress of that can trigger a cold sore, or just being psychologically stressed, work stress, all of this can also modulate the immune system locally in the skin. I'm not just saying your whole body, but I'm saying like the skin recognizes this, and then you can have a breakout of a cold sore as
Yeah.
well.
Well, and again, back to that, our skin in general, it's like just a wrapper on our whole body's health and wellness. That it
Absolutely.
somehow it all just, that's what pores do, right? It just oozes it out.
It's the biggest organ in the body.
Exactly. All right. So let's talk about what you're seeing in your practice, what people have been coming in with. In particular, I was shocked. The first thing we're going to talk about is hair loss, which never even occurred. I didn't think about it and didn't even occur to me like that you'd go to a dermatologist for it, honestly. So tell me about that. I want to spend a little bit of time on that because that one I found a little bit surprising. And literally, I just said this to you on a Facebook group, a neighborhood Facebook group. Some woman was just saying yesterday that she's suffering from hair loss. Help, please.
Yep, absolutely. I think more than anything, there's lots of cases of, I see lots of skin conditions every day. And in one patient, I may see multiple things. For example, I'm doing a full skin check for skin cancer. I'm doing acne recommendations. I'm doing kind of Botox and like filler discussions. But hair loss has been the biggest question that's come up in the last 6 months. And I do think that people are a lot more stressed because of COVID, whether they've lost their jobs, whether they're changing the job environment, whether you're used to be at work and you have this lovely social environment, and then now you're at home alone. Everybody's, whether they know it or not, is stressed about COVID or because of COVID, or if they've had COVID. And medically, we call that telogen effluvium, or stress-related hair loss. And I'll explain telogen effluvium in a bit, but it's a long discussion. But in essence, it puts your hair in this cycle of actively falling out, and as opposed to actively growing. And patients are noticing it by a lot of hair shedding all over their apartment or their homes, and they're coming in a lot for this problem.
So first of all, is it men and women are having it? And is one more prone to it than another?
Yes. The answer is, I would say male and females are both equally affected. However, I would say that I think women are noticing it more, at least in my practice, because of the fact that I think one is also, can I just say that I think they're just not going to the barber or getting their hair cut as much.
Men?
And so their hair is actively longer than they've ever had. And they're like walking around their house being like, why is there hair in my bathtub and my kitchen
Right,
and my living room
right.
and food? Like my patient yesterday mentioned, she was like, my kids have noticed hair in my food and this is a problem. But
Hey, when that
I
happens.
I hate when that happens. But yeah, so she like pointed out, but I think a lot of women are noticing it more than men. I'm just gonna say, at least in my practice, although men are noticing it too, for sure. And it's equal. Like there's no gender preference here. Everybody kind of lives the same biological life, at least I think. And so everybody's getting affected by it. But there's the question is like how much one can do as a doctor. And I
I
would
wasn't
say
sure.
and I would say a lot of it is you have to figure out what's the cause,
Right.
first of all.
So,
Uh,
and is, I guess I was going to go to like, is it, I'll ask this and then let's circle back to the causes of it and your diagnosis of it. So in general, just to put people at ease, is this now permanent hair loss? So male pattern baldness where it's a one-way train,
mhm.
versus is this just a temporary thing? And if they can get their stress under control and if they can, get their lives back in order, that it will grow back?
Absolutely. So it's a great question. People are not going to go bald from this. I think it's like the first thing they walk into my office and they're like, "Oh my God, Dr.
Right.
Truong, I'm actively going bald.
Right.
Can we stop this? Like, is there anything I can do?" And firstly, there are some skin conditions that can cause permanent baldness. Let me just start there. And I think it is important to be evaluated if things are going south real quickly, right? But I think for my patients, the telogen effluvium or stress-related hair loss tend to be is not the one that causes permanent baldness.
Right.
You notice shedding, but as you notice the amount of hair coming off of your head at a faster rate, you should know that there is hair growing in. So the first thing I point out to most of my patients when they walk into my practice is I say, look, there's a lot of baby hairs growing in, and I'm going to fully support and help you and guide you through this next process while the hair is growing in, because watching hair grow is like watching grass grow. You can't watch grass grow and then wait and wait and wait. You've got to just trust the process and know that it's not going to lead to permanent hair loss. And so it will grow if it is stress related hair loss.
So why is it falling out?
It's a good question. And I don't think anybody like really knows what is the receptor or what is the specific hormone receptor or stress receptor that's triggering hair loss in telogen effluvium specifically. There is lots of causes of hair loss. So when a patient first comes to me, I need to evaluate, is there any other medical reasons why you're having hair loss? For example, common things in women is that have heavy periods. And so heavy periods leads to lots of blood loss, which then leads to low iron, because every single red blood cell has an iron in its center core. It's like its molecular structure. So when you lose iron, which is then you start to lose hair. So low iron, low blood, aka anemia, is a common cause of hair loss in women. Another common cause in men or women is thyroid. So if you have changes in hypo or hyperthyroid disease, thyroid's an organ that sits right here, but it can cause you to have weight loss or significant weight gain, depending if it's hyper or hypo. And these can cause also hair loss. So when I say telogen effluvium, I say stress-related hair loss. It doesn't have to be mental or psychological stress. Obviously, we're talking this in the setting of COVID, but it could be a physical stress. For example, another example commonly is surgery, or the most common example is women who are pregnant and their hair is growing and growing and growing their pregnancy, and everybody's like, your hair is great, your hair looks great. And then the moment they deliver their baby and they have either just a natural vaginal, spontaneous vaginal delivery, or a C-section, which is a big abdominal surgery, they undergo a hair loss that we also term telogen effluvium, right? So mental or physical stress can trigger this stress-related hair loss. So I got to figure it out for you. Like, what caused this? And if it is thyroid or iron or deficiency, then I replete that for you. But is it COVID? Is this situational? And that we determine together by excluding all the other causes.
So at what
Mhm.
point should somebody worry, and should somebody come see you? And we'll talk about actually telemedicine later on if we get a chance to, just in terms of
Yeah.
like, because that's been an aspect. So, here I am, I got some extra going on in my brush. When do I worry?
Yeah, it's a good question. And I think everybody has their different worry limits.
Mhm.
I think some people worry at like, oh, someone else noticed, or,
Right.
as long as, I think for me, it's like what I can do as a doctor to help you, because people worry at different limits. I think if it's just different than your baseline, but you'll wait it out and, you're more of a, let's kind of see how it goes kind of person, then I would say telogen effluvium can last for a period of 6 to 12 months. So if you think it's COVID stress related and you're patient, may as well kind of see how it goes in the next 6 to 12 months. And then you could see that the hair stabilize over that time.
So,
If you're like,
so,
oh,
so even though like we've been stressed for 10 months now, And it looks like we may be stressed for a while longer. So
Right.
is it, so will it stabilize or will it just keep coming out? And again, I think it's not like there's bald patches in my head. It's
Right.
simply more hair in the drain, more hair on the brush.
Right.
Right.
So, and that's the next thing we'll talk about is finding ways to relieve your stress, right? Relieving modalities, for example, focusing on yourself and not the situation that we're all in right now, like meditation, yoga. All of these have been shown in multiple studies to lower stress, improve conditions like psoriasis and eczema, etc., for patients who are really it's a stress driven process. And so these things you do to take care of yourself, continue exercising, trying to eat healthy, eating a balanced diet and exercising, and not just letting the situation just come and like you're just sitting giving up, or you know what I mean.
Oh
So
yeah.
these are important to relieve that stress for you.
Now I was trying to
um,
figure out when is like this, you said it's a 6 to 12 month process. So
mhm,
for example, if I had C-section or if I was in a car accident or something, so some event stressor that then suffocated my hair and it started falling out. So then I
exactly.
understand it's 6 to 12 months for it to come back. Where we've been
Exactly.
in this chronic stress phase, is it just something that they need to ride through, need to manage their stress? We're going to talk a little bit, a couple of specific treatments actually.
Yeah,
But
absolutely.
it also, is it like, well, as long as you're still in this stress phase, then it's not like it's magically going to stop. Do you only lose so much? And then it like, does it reach some level of equilibrium? So they don't
Mhm.
have to worry that they suddenly are like, tissue thin hair. Um,
Yeah. I think I agree. That's a good question. I think most people do reach some level of equilibrium.
mhm,
But what I mean, 6 to 12 months post the event. So, like, you
right,
have to stop the problem first. So, like, for example, the easiest example, like you said, was like a surgery event.
right,
So, for example, you undergo a mastectomy
right,
after having diagnosis of breast cancer.
right,
So that's an end event. You have that
mhm,
diagnosis, and then you do the surgery.
right,
So starting from that moment, it's going to take about 3 to 6 months for your hair to start to fall out. And then you're going to have to watch it grow back in
for
for
another
another
6 months. Right.
or so.
Got it.
So it's like the moment that the stress event happens, you're going to start shedding over the next couple of months. So people, it's like a little bit of a time lapse. So then people don't relate it back to that event. So
Right.
like I always ask, like, oh, did you have a weight loss? Like, did you start a diet? And they're like, yeah, I lost 10 pounds over the last 6 months. And I'm like, have you noticed that that's when your hair started falling out?
Losing 10 pounds will have them lose weight.
Oh, for sure. Weight loss.
Seriously? Wouldn't they
At,
feel good about that?
they'll feel great about that, but then they start to see that their hair comes off.
Why does their hair come out if they're losing weight? Assuming
Because
that they're losing weight because they're eating better and exercising more.
or it's because they're taking supplements and causing them
Oh,
to
well, that's
well,
different. That
a variety of reasons.
right,
So I always say hair is evolutionarily, speaking of evolution,
right,
evolutionarily just a cosmetic thing for your body.
right.
Like it, I say it's equivalent to having peacock feathers, right? So it's just to inherently
Mhm,
attract the other species, the other sex, shall I
right.
say. And so, if you have so much energy and so much in your body, and you use all of it to feed your brain, feed your heart, feed your other organs, the last that your body wants to devote energy on is your hair or your nails, which are
Hmm.
pretty useless entity for you other than as a decorative thing. And so it's the same idea, is that your body is utilizing its energy to do something else.
Interesting. Yeah, I didn't think about that part of it, but I was surprised that weight loss would create it. I don't, not anybody who's trying to lose weight because it's important for your health, don't stop losing weight because because you're going to lose yours. Let's talk. Okay, so what did they do about it, Allison? So what are things they can do? So as they're, and at what point do they need treatment versus, again, we're going to go to the stress management piece of it, but what are the other things that they can do in the interim if they're starting to get concerned? They came to see you, now go.
Right. So most people who lose hair due to stress has it fall out in a pattern that looks like hormonal hair loss, which is why people think, oh, I'm going bald like my mom or my dad did. And the reason, so hormonal hair loss is medically called androgenetic alopecia. And I might just make one addition is that alopecia is just a very broad term for hair loss medically. There's many types of alopecia. Alopecia that you mentioned before, where there's like little circular bald spots,
Mhm.
is a condition called alopecia areata. Um, and that is a specific diagnosis. It's an autoimmune disease, etc. And there are treatments for that. And then we go into the world of alopecia that I just mentioned, which is non-scarring. So it doesn't leave a scar and will grow back. And that's what I termed telogen effluvium, which we said stress-related hair loss, or what I just said was androgenetic alopecia, which is hormonal hair loss. A
Okay.
little bit on hair loss.
More than
Other
I ever
type,
want to know, and no one can spell it anyway right now, but that's okay.
but I think I always get that I like
Right,
when people walk in and they're like, I have alopecia.
right,
And I'm, you sure do.
right.
Tell me about it. But they think that alopecia means like bald. And in my world, alopecia does not mean bald. It just means that you're noticing hair loss,
Right.
right?
It's like
Um,
Kleenex.
it's like
It's the
grass.
Kleenex of hair loss.
Exactly,
Right.
exactly. It's a very broad term.
Yeah.
So I don't want people to think that like you are bald and you're alopecia.
Right.
But what I was trying to say is like as you have stress related hair loss, it falls out in a pattern that looks like hormonal hair loss, which is why people are thinking they're like now like their mom and dad who's like
Right.
70, 80, 90.
Right.
Like, oh, I'm going to be like them tomorrow. Please
Right.
stop this.
Right.
So we use the same treatments for hormonal hair loss to support you through this process, if that makes any sense.
Right.
Like we're treating kind of the hormonal hair loss component and kind of supporting you through this process. But the idea that is that this one is temporary.
Right.
Whereas hormonal hair loss is an ongoing process that many men and women experience. And like you'll see it in the men as like you lose the front sides and then you lose the
Right.
top of the in women, it presents a little differently where you start to lose this section of your hair, like mostly we call it the crown.
Right.
But when you have stress, though, it kind of does look a little bit like it's evolving in that way, and so that's why people get a little bit more anxious about it.
Got it. Okay. So I think
So
you said that there's a shampoo that they
yeah, so
can use.
yes, the first thing that I recommend is a prescription shampoo called ketoconazole shampoo. It is meant for the treatment of dandruff, but ketoconazole, if you don't know, used to be a pill available as a antifungal pill.
Right.
So azole are antifungal pills.
Mhm.
It's not available anymore because there's a risk of liver damage, etc. But this is a shampoo. There's very
It doesn't
minimal.
go through the liver. It's just right.
Exactly. Exactly.
Will they
It's still
absorb it in their when they use it on their hair? Well, it just stays on the top. They're not absorbing it into their skin.
So all topicals absorb to small degrees,
Mhm.
not to any significant degree. That's
Okay.
correct.
Right.
But everything eventually gets processed through the liver for your body or the kidneys, and
Right.
so it just in that way. But ketoconazole shampoo is has a little bit of anti-androgenetic effects. And in some studies, head to head with Rogaine, which is also known as 5% minoxidil, it's been shown to be equivalent to the use of daily or twice daily minoxidil use. And so it's a great thing to start with as a kind of hair support to help kind of stabilize the hair loss.
And is it available over the counter?
It is available over the counter as a ketoconazole 1% shampoo.
Okay.
It goes by many different brands. You may find it under the category of Nizoral,
Okay.
but there's other companies that make that as well. The prescription version is obviously a little bit stronger. It's the ketoconazole 2% shampoo. And I recommend it on a daily use, but some patients don't like to wash their hair daily.
Okay.
So I'm just going to be honest. I see patients of many different skin types, skin colors, etc., of different backgrounds. And so some people can only wash their hair once a week, once every 2 weeks. And so for these patients, I tell them to bring it to their hairdresser, and then they
Right.
could have them wash their hair for them with the shampoo.
Got it.
Um, Follow it by a conditioner, because the medicated shampoos tend to be a little bit drying on the actual hair itself. Um, and that's what one of my initial recommendations are.
Let me digress for a second because you just made me think of something. Are any different hair types more prone to this type of alopecia, and or would color treated hair or permanent, weight, hair that's been treated with any kind of chemical be more prone to hair loss through all of this?
Huh, that's a good question. I think to answer your first question, um, different types different types of hair, for example, can undergo different types of alopecia. But if we're just talking about stress related hair
Right.
loss, and
Yeah.
everybody's I think on the same page there. But for example, my patients who are my patients who, for example, have curlier hair or don't wash their hair as often,
Mhm.
or have to do a lot of, you know, like straightening maneuvers,
Mhm.
or use chemicals in their hair a lot, they can undergo a different type of hair loss that can lead to permanent scarring. It's called frontal fibrosing alopecia. And or traction alopecia, you may know that, where if you have your hair in braids,
Right.
it tugs on your hair,
Right.
and over time that tugging can create scarring along the front of this area,
Yeah.
leading to permanent hair loss. Because I always say the moment I see scar, it's like pouring cement
Right.
over a patch of grass. The
Right.
grass can grow around it, it can't go through it.
But
So
that's different that's permanent. But like I've got color treated hair. Does that mean that I'm more vulnerable to hair loss, or if I've got very curly hair or straight hair or fine hair or or anything like that? So the answer
no,
is no.
not
Okay,
no.
cool. All right. So let's how about you mentioned Rogaine and minoxidil. So that a tier two? If
Um,
if the
part of
shampoo doesn't work?
it's part of my topical regimen
Right.
for stress related hair loss. So
Okay.
um, it's FDA approved for the treatment of hormonal hair loss. Let's clarify that. So what does that mean? It means that there are enough studies to support that the medication is meant to be used for the treatment of hair loss due to, for example, male pattern baldness or female pattern alopecia. But it's not studied in the setting of telogen effluvium in any regimented way. But it is helpful in the same way that it helps with androgenetic alopecia, meaning that if you use it, it can grow hair. But there's a few side effects that one should watch out for. One is a brief shedding period. So, I always say it's like, you have to clear your lawn of the old grass before you can put new grass in.
Right.
So some patients experience a little bit of shedding when you first start, and that scares people. The other thing is you can get excess hair, like little baby fine
Right.
hairs along, your jawline
Right.
or your chin.
Right.
And people, it's so subtle. It's always really subtle in my patients, but eventually you may notice it, and then that's a possible side effect as well. Usually, some of the studies say use it on a daily basis. Some of them say twice daily. Most formulations come in a liquid or a foam. It's just whatever you're willing to use or how you want to use it. I'd say at least daily use. And it's meant to be for the period of the 3 to 6 to 12 months to get you through this like
And
stress related
and
loss.
then again, I think do I need a prescription? Do they need a prescription for minoxidil or no? That's over the
No, not
okay.
that one. No, yeah, you can just drop by the store and get it. And, the men and women's formula are equally great. They're
Okay.
technically very similar.
Pink box, pink box and blue box. Okay.
Mhm.
All right. So hey, Suzanne asked a question. She wanted to know about if any supplements like biotin might be
Ooh,
helpful.
great question. Hi,
Thank you,
Suzanne.
Suzanne. Right.
So biotin is I would say, based on the studies that I have read, there are some studies that support it in the hair loss, and some studies that has no effect on hair loss. Does that
Mhm.
make sense? So in
Clear in
essence,
mind.
that if patients, so biotin it's a vitamin B,
Mhm.
and so B vitamins generally are water soluble, meaning that when you take in when you take the vitamin or have enough of it in your body, you'll pee it out.
Right.
There's no excess amount that will, like, if you have 500 biotin, you're not going to get to 1,000 by taking more, because your body's going to self-regulate. It's going to be able to excrete it out in urine. Unlike some other vitamins like DEAK, where you can accumulate enough vitamins to
Mhm.
a toxic level,
Yeah.
actually. So B vitamins are generally, you can't get too much of it. So if you're deficient in it, some of my patients are biotin deficient, and there are some genetic diseases that make you biotin deficient, then taking it, I think, is very helpful for strengthening your nails and strengthening the hair,
Mhm.
etc. But if you are a normal person taking normal amount of food and have no deficiency, I doubt that it would be very helpful, which is what the studies reflect, is
Gotcha.
that sometimes it helps people, sometimes it doesn't. But other supplements are helpful. For example, there are supplements that are targeted towards hair. For example, Nutrafol, Viviscal, and I often recommend prenatal vitamins for women. And the reason is, like I said from the beginning, a lot of women experience a lot of experience underlying anemia or low blood counts, low red blood counts. And so having that tiny little supplement in iron can be somewhat helpful for growing hair.
Do they need to be sure, because I know we're always very sensitive about having people take additional iron if they don't need it. So should they check with their doc before they do that at all?
Absolutely. Absolutely. And obviously they're at my office and I'm making this recommendation
Right, exactly. They're in front of you. And with B vitamins,
in the setting of,
we'll often talk about how older people become B deficient. So that as you get older, that you're increasingly B deficient. So a lot of people, we bottom line will often recommend, just in general, B multis. Um,
yes, because there's no way you can be toxic
right.
on it.
Yes.
You'll, if you take, they always say Americans have the highest, have the most expensive urine, right? We're like taking supplements. As long as you're
Supplements, drugs.
a lot of vitamin
Yeah.
D, E, A,
Yeah.
K. Like there's very few, you can't overdose. Well, I don't know. You can probably overdose on anything, but taking it as recommended is absolutely safe and fine. And if it fine, and it doesn't hurt. So give it a try if you're just at home and trying your best to grow your hair, but don't take anything in excess.
Right. And I always say, again, check, most of this is safe, but check with your own doctors, because we don't know what your specific health profile is, any medications that you're on that might have any kind of counterindication.
Yes, thank you for that disclaimer. Yeah,
I've got my
please.
lawyers back, right? Always make sure that you disclaim that.
Yes.
But one other hair thing, and then we'll move on to these other topics. And I know you've got patients coming up shortly. But let's talk about platelet-rich plasma, PRP therapy, which you said is a new thing that's being done for hair loss, even for stress-related temporary hair loss.
Absolutely. Yes. So we find that it's helpful in stress related hair loss as well as hormonal hair loss. Now you guys know the terms telogen effluvium and androgenetic alopecia. So PRP is platelet rich plasma. How it works is we draw your own blood. We take the yummy nutrients from your blood, the platelet rich plasma portion, and we inject it back directly into your scalp. I already told you, your nutrients are there's only so much. So then we're just repurposing it into a different location. And we're like telling your body, hey, the scalp needs energy and some
Right.
nutrients too. And so that's kind of how it works, or the theory behind it. Some of the patients do undergo a brief shedding period, like I said, similar to the Rogaine, where you start to notice a little bit more hair loss, but eventually most patients stabilize. And it's not FDA approved yet for this condition. So it's more that, many things, it's a cosmetic treatment in many dermatologic practices. Not every dermatologist carry it, but you definitely can ask your local dermatologist to see if they offer it. It is expensive though, and is not a permanent cure for anything.
Right.
And so one should know that. I
And
think it's
insurance
definitely,
probably won't cover it.
unfortunately not, no.
Okay.
And
It's
it's
different.
amazing, right? I always say it's like cleaning your teeth. You
Right.
gotta keep it going
Right.
to achieve the benefit that you want.
Is it one injection or is it injecting all over? Like, um,
It's a great question. And I generally inject it in the areas that patients are experiencing the most amount of shedding because the volume may be limited by how much blood we can draw from you or something like that. But for women, mostly in this region, for men, in the areas they have loss. And it's a series of injections. So it depends on your provider, but it's usually a series of initial monthly injections followed by a maintenance injection.
okay. All right, there we go. Okay, so that's hair loss. Let's talk now about just, I think, broadly and briefly about all the other things. So in terms of stress and your skin. So with eczema, psoriasis, hives, herpes, acne, rosacea. I'm going to
Yep,
lump all that together a little bit because any of those can be inflamed at this point in time.
correct.
Right.
With stress, for sure.
Right.
And the winter weather it's getting colder, at
Yeah.
least here in Los Angeles.
Oh no,
Um,
Los Angeles, they don't get cold in Los Angeles. It's
oh
beautiful.
my God.
Right.
Well, we're embarrassing. We're
Right.
just like, the moment it hits like 40s or 50s, we're like, it's cold. And we're spoiled creatures down in.
For you. So, and with any of these, so whether you, so what should someone do? So if somebody has already had it, then they know that they've got it. We're going to talk in a minute about back to the stress things. I just want to go through that a little bit again.
Absolutely.
But so anything in particular they should do besides treat it the way they know how, call their doctor to just be sure that they don't need to increase dosing on anything that they're taking or doing.
Absolutely. So, it's hard to lump all those things together because in a sense, every single one is treated a little differently. But I can say this, studies show that winter weather and stress can flare patients' psoriasis or eczema, and et cetera, et cetera.
Right.
Stress has been shown to make acne worse, as evidenced by many of my patients. So
We're going to talk about maskne if we get a moment.
it's a popular topic.
Yes.
But so eczema, psoriasis, acne, hives, stress hives, right? So the answer is that you could be fine and dandy, and then all of a sudden you have a flare up because of the situation, right? Whether it's because the cold weather triggered it. So, couple of things, like let's talk about eczema briefly. Making sure you're moisturizing every day, making sure you're using a cream, a thick moisturizing cream after you bathe can prevent flare ups, right? And then treating it the way you know how, with either, people like doing over the counter topical things, which if it works for you, go for it, versus a prescription topical steroid or topical calcineurin inhibitor, etc. So if this works for you, go ahead and keep doing it. But if you have a flare up to the point where the things you're using is not helping anymore, that's when you go and seek your local doctor or your dermatologist so that they can give you further advice on how to quote unquote control a flare.
Right.
Mhm.
Gotcha. Okay. So, and if somebody hasn't, so there may be people that never had a problem with their skin whatsoever, and suddenly they've got weird red splotches on their body. In that, should they ride that out for a little bit? Like at what point? Because you don't want to be like, oh my God, I gotta, go in this minute. So should
Yeah.
they ride that out a little bit, or at what point do they call so that they can get support for whatever and a diagnosis to be sure that it's not something dangerous?
It's kind of going to depend on you. I think if, people have oh,
I lost you. There you are.
sorry, people
That's it.
have very degrees of, their ability to kind of handle the situation. For example, like stress hives, you can be super uncomfortable. You could be super itchy. It could prevent you from working. It can prevent you from, taking care of your kids and stuff like that. So I think if it's affecting your quality of life, that's when you like
Right.
kind of put things aside and say, hey, it's time to go. Obviously, these conditions can just be like, all my patients play Google Doctor, which I actually love,
Right.
because I think it gives them a foundation so that when they come into my office, I can give them my spin on the
Mhm.
story. And they're like, I know it, Dr. Trong. I reread it. And I'm like, good for you.
Right.
Because really, it's all about education and treating, I'm just trying to help you. And so at the end of the day, if you can like get some of that background information, I could direct you to where you need to find it.
Right.
That's good. But like, if you're just not, it's not getting better, please come in, because obviously it might not be what you think it is.
Right.
There's about, like, even hives alone, like it could be caused by viruses, like COVID rashes, some of which looks like hives. And so a few things, I mean, we're not going to go into COVID rashes today. It's a whole nother discussion.
No.
But there is like certain rashes that could be, what you think is stress hives or whatever, could be a totally different condition. So if it's not responding or kind of looking like what you're reading, then seek further medical advice for sure.
Got it. Okay. Or if it continues to get worse versus kind of holds or
Absolutely.
back. All right. So let's go back for a moment. You mentioned a bunch of the stuff quickly with stress management in terms of meditation and yoga, but again, and I've been talking about this for months in terms of the foundation and strengthening your body and your immune system to be able to fend off everything. And same thing here, that the stronger your underlying body is, the more you'll be able to fend off these skin offenses. So beyond yoga, meditation, you said exercise. How about dietary things? And you mentioned some supplements as well. Are there other supplements that are good for your skin that people can or should be taking beyond the ones that you mentioned before, the prenatal vitamins, et cetera?
Yeah. So I think it also depends on what type of disease process, because most of my recommendations come from the fact that there is evidence-based research behind it. So I would say, for example, like, let's just talk about psoriasis and stress, for example. We know there's a study on light therapy. So a lot of psoriasis patients undergo light therapy, which is you shine light on the patient, specifically a specific wavelength of light, 313 nanometers, which is what we call narrowband UVB light, and it's anti-inflammatory directly on the skin. The great thing about it is there's minimal side effects other than the possible risk of sunburn, which I try not to do for people. But in essence, like, this light, with patients who are meditating versus like with meditation tapes, and then versus patients who are just doing the light without meditation, we find that the ones who are meditating and getting light therapy do better, right? And there's like this was actually done in like the 2000s. It was like a long time ago. But we know, like, your stress makes you more itchy, makes the eczema worse, makes this worse. Makes the hair loss worse, makes the acne worse. So, we know that there's something to it. I just can't tell you it's this protein that goes up or down when you're stressed. And like, you can measure cortisol levels up to the wazoo, but that's another question. They're like, why can't you just measure my cortisol level? But cortisol levels
varies every 5 minutes.
It changes throughout the day. Did you just drink your coffee? Did you not? So coffee, alcohol, smoking, these things we know trigger more inflammation in the skin. So do as you may, but I think, like, I mean, to be honest, I love my coffee. So everything in moderation, but like smoking, like, these things we know are bad for us. So got to cut that out. In terms of diet, there's a lot of diets out there. I'm not going to propose to say that I'm a nutritionist by any means, but there's things like, for example, psoriasis patients who take certain amounts of turmeric or curcumin is helpful for their psoriasis. I'm not going to say everybody, right? Some patients don't respond at all, but some patients do benefit a little bit from that. So there's certain anti-inflammatory, and it's actually, I can only make the studies based on specific medical disease diagnosis. So I would say seek your doctor for a specific diet recommendation that's targeting your specific medical illness. But in terms of, like, speaking of like hair loss, like, I haven't found that there's any specific diets that people can go on to like grow back hair or something like that. But it's very specific to the disease process.
I was more thinking kind of tamping down potentially the inflammatory foods. Again, no surprises. Sugar, fried
fast foods. Exactly. Like, for example, let's speak about acne, like fast foods, greasy foods, high sugars, sometimes chocolate, certain dairy products can worsen acne. So cutting some of these out and seeing if there's any benefit for you.
Well, and again, it's been hard because people, then there's been the people that have been stress eating, right? So everybody's running toward their comfort foods while we're home. So
Sign me up.
we all are, right? Everybody has. That's why then I exercise so that I can, get away with that piece. It's really hard, but
Yeah.
understand all these choices are feeding into our skin or everything else. Let's spend, because I only have about 5-6 minutes with you. Let's talk about maskne for a second, because it's something that everybody with their masks, they're suffering from assorted things. So can you talk for a minute about that and what people can do? Because we're going to be wearing masks for a while.
Yeah, I'm actually quite worried about the rising cases in at least Los Angeles County, but also around the world and the United States. So we're going to be wearing masks for a little bit more time until we figure out this vaccine
Right.
situation. Right? And even then, I think we all should still protect each other. I think it's our civic duty to take care of each other, our families, our friends, and ourselves. So mask is kind of here to stay for a little bit. It's kind of nice to see you, Sarah, without a mask because I see so many people in masks
Right.
all day. But briefly about mass acne, and you can see, there's lots of articles about it. But
Mhm.
firstly, is hygiene, hygiene, hygiene. So one is you wash your face when you wake up in the morning. And for me, I like to recommend just simple sunscreen, zinc, titanium oxides, zinc oxide, titanium dioxide sunscreens are great to create a barrier between your skin and the mask, right? Same like I always say, it's like kind of like babies and Desitin or zinc oxide. You're just kind of protecting the skin underneath this mask. You wear your mask. Try not to put makeup in the areas that you're wearing your mask. Like you do your pretty eye makeup or whatever, but just kind of avoid the makeup because a lot of makeups are comedogenic, meaning it can cause blackheads or whiteheads.
Mhm.
And so even if your makeup is not comedogenic, sometimes it could still be occlusive, meaning it covers your pores and it can
Right.
cause, especially when you're wearing the mask for 6-8 hours a day. The moment you come home, take off your mask, wash your hands, sing a happy birthday song,
Or two.
give it a few minutes, right? And then I always wash my face. So a gentle cleanser, something without any medicated stuff in it, is great for simple prevention, right? And then you obviously wash your hands, take off your mask, wash your face, and then that's a simple hygiene. But then now you have mass acne. Okay, that simple regimen might not
Right.
work anymore. So one is you may want to switch out that cleanser that I said, that the gentle cleanser, to something that's a little bit more medicated for the treatment of acne. So benzoyl peroxide, salicylic acid, glycolic acid cleansers are great for treating and preventing acne as well. It's drying. It's a little irritating. Some people, especially now that it's winter. So use with caution, but
Right.
like you would substitute that cleanser in the morning at night for a medicated acne cleanser. You can find this in the over-the-counter aisle.
Do they just do
Try
it in the areas of the mask? Because again, a lot of people they're developing acne, but they also have drier or combination skin in other places. So
right,
I don't necessarily want to use salicylic acid on my forehead.
right. So if
I'm
that there's
stating
no
the obvious, but
there,
right,
do as you may. If there's
right,
no acne here, go down here.
right, right.
Um, For sure. And then if that doesn't work right and you're doing it, you're like, I've been doing it for a few weeks, no improvement. That's when you might have to want to go to your doctor so that you can get some prescription topical medicines. For example, clindamycin lotion, azelaic acid, et cetera, et cetera. These things are helpful for treating acne. And of note, are if you're pregnant, if if your skin is super sensitive, etc. As a doctor, I make different recommendations because certain things are safe in some people and certain things are not.
Now, how about beyond acne? There have been, I'll call it, is it like just fungal redness patches and stuff, or other sensitivities that are going on under the mask that people,
Absolutely.
yeah. So how do they prevent that? Because
The most common actually that I've seen, just to go back to the fungal stuff, is an allergy to the mask. So for example, like a lot of the disposable masks are made of blue, and some people are really sensitive to blue dye.
right,
And so people get rashes on just their lips. That's like
right,
the area. It's hard to treat, lip rashes, etc. So note like what you're allergic to, and possibly like it keeps happening in the exact same area. That's a
Mhm.
sign that it could be an allergy. Okay. But fungal acne, I would say, is quite rare.
So I don't
um,
mean fungal acne, I just mean red spots. So,
red
right, red
Yeah,
spots, like,
so red
in
spots.
creases or around, just around on the face where you haven't used to been covered, but now suddenly you're in this steamy environment.
It's a great question. So it could be fungus. It could be likely more irritation or an
Mhm.
allergy.
Right,
Irritant, irritant contact dermatitis, which is more common, or allergic contact derm, which is just the fact that you have something on your skin that is rubbing at your skin.
right.
And it's like, and then like we see it all the time behind the ears, right? Where like the strap itself is like rubbing, and
Yeah,
we're not allergic to the strap per
right,
se. Just the strap is like pushing and tugging on the back of their ear. So then I'm like, use little hair clips,
right.
or tie the straps together in the back, and then just make a little tie in the back so that it's not pushing on your ears. But people can get big sores from these things if it
Yeah.
gets repeated, and so you got to try to prevent that.
And then can they, and again, I know that you gotta go. Can they try like either a little
Cortisone.
cortisone cream or the antifungal creams on their areas, on these areas to see if that'll tamp any of that down?
If it's burning, it's probably an irritation.
Mhm,
If it's itching, it's probably an allergy.
mhm.
And so a hydrocortisone cream will likely help. But if it's not better after a couple of days of use, it could be a bacterial or fungal infection or
Right,
something else. And you may want to make sure by doing a skin culture that can only be done when you're dropping by your
right.
doctor.
As always, right? Watch it for a couple days, try it a little, and then give a call. All right, Dr. Allison Truong, thank you so very much. I really appreciate your time and your wisdom. And
Thank you.
thank you. And everybody else, next Wednesday, 4 o'clock, watch your Facebook Lives and let everybody else know about these great conversations with our fabulous experts. So thank you very much. Thanks all.